Hey, what's up, YouTube? My name is Robert. Welcome back to my world. Today, I'm just going to talk about um, the treatment process that I went through the last couple of days, which was Wednesday with my last treatment, and Tuesday I got my white cell blood count shot and some antibiotics to help me through the week. So that's what basically after every chemo treatment that I have to go through. Every chemo treatment that I have to go through after that. So I'm doing good. This Sunday or Tuesday, I got admitted to the hospital late at night for a fever, but they were able to take care of my fever. So luckily, I had a infection in my blood. Turned out to be pneumonia. So that's the process of what cancer patients have to go through after chemo treatment. The chances of getting what's that word? Sick, because your immune system is completely almost shut down, but barely surviving. So you need like a booster to where a white cell count where to help you fight infections. So what the white cell does, it protects your immune system and fights your sicknesses like the flu. Helps your immune system fight off any bacterials that come in. Sometimes you need antibiotics to help you, but for me, since I'm a cancer patient, it's more I need more help because my white cells are so low that I need help with antibiotics, a little bit of fluid, and everything just to help my body regain white cells, so protect me throughout the week. So that's why the cancer patients go to blood work every twice a week, 3 times a week, just to keep where the white cells count out, just to check the white cells, your blood, your platelet levels, your kidney levels, check everything just to make sure your body's doing okay. And if they find infections, at least they'll keep you informed and your oncologist informed what they need to do. It's always to go have an oncologist wherever you are. Let's say you go to MD Anderson and you're in Dallas. To have an oncologist on standby in Dallas would be significant help to you and to your health as well, because they can keep an eye over there. If anything happens to you over there, they at least have the information from MD Anderson that the doctor can use. So, okay, for instance, they already know that your white cells go really low. So the doctor over there, okay, this patient's white cell goes low after chemo treatment, so we have to keep an eye on him. So every time he does blood work, if his white cells go low, we'll give him a white cell booster shot. So it's just more efficient that way. Now, if you can just stay at your local oncologist, where let's say like you're in Dallas, San Antonio, whatever state you're from, you have an oncologist. You get your blood work checked twice a day. After you get your chemo treatment, wear a mask. Even though you're susceptible to getting viruses, the mask will help at least you a little more, give you more protection than anything else. But sometimes you're just gonna get your white cells. You're just gonna get sick and get a fever. So sometimes you just have to go with the flow, and hopefully it doesn't happen. Just helping you find good ways to protect yourself when you do chemo treatments and stuff like that. So just make sure you wear a mask, wash your hands daily, have hand sanitizer on you. If you have pets at home, it sucks, but sometimes it's best to have them in a different room far away from you. I know it's hard to hear sometimes, but sometimes the pet dandruff and or cat dandruff can mess with your immune system. They can bring pollen from the outside that can come in with them. If you have an air purifier, make sure you get one to put in your room so you can have air purified air. Drink plenty of water, constant water. Drink water, Gatorade, sweet tea. Ensures depending on what flavor you like, milk chocolate, vanilla, strawberry, whatever, that will help you also as well, give you your vitamins which you need, like calcium, potassium, vitamin D if you want to go outside, but just make sure you wear a mask. Then you got, just got to be careful. Sometimes you can just get sick even wearing the mask, but if you know your body really well and you can sense something's wrong, you don't hesitate to go to the ER. If your temperature is like 101, 102, just go to the ER. Don't take chances and say, oh, I'll take 2 Tylenols. No. Just go to the ER, make sure everything's good. Even if you get admitted for a couple of days, it may suck, but you know what? At least you're going to be taken care of. You're going to be healthy. And it's just more easier and to deal with than getting super sick, and then you may get real sick where you can die, where you can come like more disabled. You can just be more, just be more conscientious. Sometimes you're just gonna have to be selfish, and it sucks. And I know you say, I don't want to be selfish like my family. Yeah, sometimes they're gonna have to cater to you more, because with this white cell blood count, when they're all so low, sometimes you need to sacrifice what they sacrifice for you just so you can stay healthy and to keep you healthy, so you can fight this cancer or fight the cancer and do all that stuff. So I'm gonna leave it like that. Hit that like, subscribe button. Leave a comment. I read all comments. Again, you all have a beautiful, wonderful day. Good evening, and until the next video. Peace.